Good afternoon, everybody. My name is Tala Ahmed. I'm a sixth-year medical student at King Saud bin Abdulaziz University of Health Science. So our paper is a descriptive analysis of a pregnancy-associated breast cancer in our tertiary center at the National Guard Hospital in Jeddah from 2002 to 2019. It's under the supervision of Dr. Hatim al-Fikri. So what do we know about pregnancy-associated breast cancer, or also called gestational breast cancer? It is defined as being diagnosed with breast cancer during pregnancy or 1 year postpartum. It actually has a very low incidence and is considered to be 7% among all breast cancer patients. And the incidence start to increase due to delaying the childbearing age, so this can increase the incidence furthermore. As we all know, pregnancy already causes a lot of physiological distress to the mother, so let alone having a breast cancer. So it's very important to try to explore this topic because it's considered to be a medical dilemma, since we're not only dealing with the pregnant woman alone, we're also dealing with the fetus that's inside of her. So what are our objectives for this study? The aim of this study is to investigate the outcome of a pregnancy associated with breast cancer on the mother's health, and the objectives are: one, to describe the maternal breast cancer outcome, to present the pathological characteristic of the tumor, and three, to investigate the type of the intervention done during the pregnancy. So we took all the pregnant cancer patients from 2002 to 2019, and we searched for the patient who has actually were diagnosed with gestational breast cancer. And they were actually out of 1,106 pregnant breast cancer patients, we found 58 patients who were diagnosed with gestational breast cancer. And most of these patients were actually diagnosed during pregnancy, not postpartum. And the most common type of cancer that our patient has are actually invasive ductal carcinoma. And the most common receptor there was estrogen receptor. And mostly they were diagnosed at stage 2. So what kind of a treatment or intervention the doctor decided to do with this patient? Mostly it was a combination of surgery, which mostly it was lumpectomy, and radiation and chemotherapy, mostly doxorubicin. And what about the outcome of this patient that we have in our study? Unfortunately, most patients have a very poor prognosis. How do we describe that? As we can see here, most patients either have still the cancer, either had a recurrent, or died due to the cancer. And only 11 patients out of the 58 actually were treated from the cancer. And regarding the obstetric outcome, unfortunately, most pregnancy were terminated. So, how do we conclude our study? It's important, as we can see, even though surgeons and doctors try to provide different kinds of interventions, surgery, chemotherapy, and radiation, we still can see that there is a poor prognosis. So it's very important to spread awareness about this topic. It's very important to include larger studies from different centers so we can have a better understanding about this condition. Thank you.
This, I need to ask you a couple of points, because it's obviously most of your patients had termination, so we're not sure, but they were diagnosed during pregnancy, so you associated the pregnancy with. It's not really clear in young patients how much the pregnancy increases the risk of breast cancer, so we cannot really conclude that this was the confounding factor for obviously having a bad disease. That's one point. The second point, obviously, maybe describe a little bit more about those patients, maybe at least the 58 ones. What was the pathology? What did they have done? Did they have surgery? Or what stage were they at the time of diagnosis? Because obviously that's what affects the diagnosis. So in order for you to publish it, just maybe a little bit more description on that, that will give you more of an outcome. Did the pregnancy-associated ones have a better prognosis to the others? But they need to be comparable, and obviously we're not comparing them because we're not describing the features of each one.
Very nice. I mean, the concept, lovely, and we really need more data about this because this is nowadays we are facing more and more. But again, always the way I look at any study, I look at the objective, I look at the conclusion, and I try to correlate. So when you look, you said you are doing a descriptive, you should not come with a conclusion saying that yes, it's almost because you are describing what's going on. So here, as Prof. Ahmed said, what about those? Because out of the all breast cancers, like 1,000 plus, 58 cases only pregnant. are you sure the others did not have pregnancy and terminated early?
Unfortunately المشكلة إن إحنا عندنا مرة يعني limited number of patients.
No, I'm fine. I'm not saying. I'm just saying.
أيوة،
If you don't know, then you need to spell it out because here I will say I cannot come with the prevalence out of this if I don't have that data. You should say it. The other thing also regarding the, discussion. What you said here as a conclusion associated with prognosis. This is against what we are now counseling our patients. That the evidence showing that pregnancy won't actually make it worse if they're cancer. It depends on multiple factors. So I think what you are showing here, it will be very nice and helpful to see what is the situation and what is the literature, and then we can, if you cannot go in much details to come with it. But always you have to be very careful with your conclusion wording. Right? But well done.
Thank you so much.
طيب عندي سؤال. انت قلتي most of them are terminated صح؟
صحيح.
لكن كاتبه في الريزلت 15 only terminated.
ايوه عشان هو ال pregnancy associated breast cancer they can be pregnant or during pregnancy or postpartum. فاحنا number of the patients who were pregnant during they have a breast cancer most of them terminated their pregnancies. But 11 doesn't represent the actual total number.
Total number 50 قلتي 58 منهم كلهم كانوا pregnant. قليل منهم اللي سقط.
34.
34 يعني 50% terminated. What happened to the other 50? More than 50%. كلهم؟
للاسف
كل ال 34 ال 34 15 منهم terminated. بقى عندك 19.
صحيح.
كلهم they lost the follow-up.
نعم في عندنا 5 جزء follow up بيصير في عندنا الماجوريتي determinated.
طيب البقية اللي هم 19 باقي 15. What happened to their pregnancy? What was the outcome of the pregnancy?
Mostly well healthy.
كيف؟
Healthy. They were not terminated.
ايوه طب انت لما تقول لما maternal outcome انا لازم تبقى تبين الاوتكم حق
صحيح لو احد يقرا بدون ما اشرح يعني he will get lost. You have to mention that there were a large low
15 were had a normal pregnancy.
Yes.
When lost follow-up 16 you have to justify why did they lose it. لما تكتب البيبر بس المبدأ ممتاز.
Yes.
يعطيك العافيه شكرا لك.